Hey guys, Dr. Matt here, back again for another Wellness Wednesday. Well, our mission here at Venture is to help you move better, feel better, be a better you. And we do that by evaluating what your pain and symptoms are, fix that pain problem, and help teach you how to prevent it in the future. So let's talk a little bit about that evaluation process. Because as a patient, you deserve to be guided back to health appropriately and efficiently. Too often, many injured and ailing patients are not thoroughly examined, thus they never get to the root of their pain discomfort and therefore are not prescribed appropriate conservative care. Well, as a clinician, I want to know what is going on. What is the root? Why is this happening to you? And let's take a first visit, for example, here at Venture. When you come in, we're going to start with an evaluation or an examination. And what that looks like is a few different processes, a few different steps. First, we're going to do a thorough history. I want to hear your story about what's going on. We want to have opportunity to ask questions and answer questions you may have. Really what we want to do is begin to gather the pieces for the whole puzzle. After we've gone through that thorough history, next we'll step into doing an physical examination. And what that can look like is doing a functional assessment, trying to identify faulty movement patterns that you may have, looking for different muscle weaknesses. We might follow up with doing some orthopedic tests, because if we can reproduce that pain, it really helps us and increases our chances to correcting it. We'll also be checking range of motion, doing neurological testing as needed. But then after all that too, we want to get hands-on. We want to feel, how are those joints moving? How do the muscles feel? What are the differences side to side? Again, with the idea that we're collecting pieces of the puzzle to make a more clear picture. After we've got a bit more of that picture, we want to sit down, talk to you, explain what's going on, where that pain is coming from or why it's happening, really educate you so you have a picture in your head of what's going on. And then we want to talk about how are we going to go about taking care of you. So we want to make sure you as a patient have a clear-cut game plan and that we are executing that plan for you to its fullest. So that is one step of what your first visit here at Venture will look like. After we've gone through that report of findings, we'll begin that day treating you as long as we don't need any more additional testing or you don't need to be sent out. But next week we'll talk a bit more about that. Here at Venture, we want to help you move better, feel better, be a better you. You guys have a great week. We'll see you next time.
Everybody's moving, everybody's moving, everybody's moving, 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 moving. Everybody's moving, everybody's moving, everybody's moving, 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 and stop.